Hello, and I'm Atabong, and I'm gonna make two videos for the final assignment to English for registered nursing course. And in this first video, I am going to discuss about what makes a good nurse. Secondly, I'm going to discuss how to increase the patient's feeling of trust and safety when meeting them for the first time. And thirdly, I am going to discuss or analyze the catheterization steps. So, what makes a good nurse? First, a good nurse has to be a team player because healthcare is provided in a multidisciplinary environment. Secondly, a good nurse has to exhibit strong communication skills with patients and colleagues. Again, a good nurse has to exhibit components of empathy, compassion, and trustworthiness. Also, a good nurse has to pay attention to details because that's very important. And lastly, I will say that a good nurse has to always invoke their critical thinking skills at all times. So, the second part of the question I'm going to discuss here is how to increase patients' feeling of trust and safety when meeting them for the first time. First of all, a nurse has to dress professionally and clean at all times. This gives the patient the impression that we have the right training and we know what we are doing. Secondly, a nurse has to show genuine interest by introducing themselves and asking the patient who they are. And afterwards, the nurse always has to refer to the patient by their name, and it shows that you have genuine interest in them and trying to help them with their ailment. Also, a nurse has to be respectful at all times by showing respect for the patient's privacy as well as beliefs and practices, be them cultural, religious, and others. Also, a nurse um, could build in building trust. A nurse is required to listen to the patient attentively. In this regard, the patient needs to see that their what they are saying is being taken seriously and understood. Also, being honest and open can give the patient the trust that you may require, especially if you tell them exactly the truth about what they're suffering from, irrespective of how they may feel down. But of course, telling them the truth is very important. And in the last part of this video, I am going to talk about the catheterization steps. So, first of all, we have the safety considerations when doing catheterization to a patient. And first, you need to perform hand hygiene. Secondly, you need to check the room for additional precautions. You have to introduce yourself to the patient. You have to confirm the patient's identity using two patient identifiers. That is the name, the date of birth. You can also ask for their social security number. You can ask for their address in order to identify them. Also, you need to listen and attend to patients' cues, ensure patients' privacy and dignity, assess ABCCS, suction, oxygen, safety, and all the rest. Also, we need to apply principles of asepsis and safety at all times. Also, lastly, we need to check vital signs of the patient. But let's go to the catheterization process proper. And in this catheterization steps, I'll be talking about urinary catheter. First, we need to gather the supplies, and this includes sterile gloves, catheterization kit, cleaning solution, lubricant, Pre-filled syringe for balloon inflation aspect, the catheterizations, the catheter size, also a urinary bag, a Foley catheter. Secondly, we have to verify physician order for catheter insertion. This means that what the doctor has actually side notes that have been placed by the doctor about the catheterization process. Third, we need to place a waterproof pad under the patient. This is in a situation where fluids, come out in an uncontrolled manner. Fourth, the position we have to position the patient prone to semi-upright knees and raised. That is, positioning of patient depends on gender, of course. The gender of the patient determines the positioning. Um, Again, we have to place a blanket or a sheet to cover the patient and expose only, the required anatomical areas. Of course, that's also to ensure patient's privacy. Six, we need to apply clean gloves and wash, the perineal area with warm water and soap, or the perineal cleanser according to agency policy, the policy of the clinic or health center that you work. Again, we have to ensure adequate lighting. That's very important for patient safety. Also, we need to apply sterile gloves using sterile technique. And in the catheterization process, you need to lubricate the tip of the catheter using sterile lubricant included in the tray, and add lubricant using sterile technique, of course. And next, we insert the catheter to the urinary tract and then slowly inflate the balloon. After the balloon is inflated, you pull gently on the catheter until resistance is felt, and then advance the catheter again. This is to make sure that the catheter is in the right track and secured firmly. We then have to connect the urinary bag to the catheter using a sterile technique. And next, we have to secure the catheter to the patient's leg using maybe a securement device or a tubing just above the catheter. We could also use a tape so that the tube doesn't move freely. And after that, we can dispose of supplies following agency policy. And then, of course, documentation. It's very important in nursing. Every nursing process needs to be documented, because no documentation, of course, means that no care has been provided. So we have to document the procedure according to the agency policy, including patient tolerance of the procedure, any unexpected outcomes, and urine output. That's it for this first video, and I'm gonna do the next video, which will relate to patient conversation, the conversation between the patient and the nurse, um, about administering antibiotics intravenously, and also about home care instructions for hysterectomy discharge patient. Thank you.